Let's talk incisions for breast augmentation. All right, so the first one over here, transaxillary. So this is an axillary incision, which means armpit. The benefits of this are that it's away from the breast. So if you look at yourself in the mirror, you will not see the scar. The downsides of this scar are that it's visible when you wear tank tops or bathing suits, and it's in a very specific location that lets everyone know exactly what surgery you had. And I don't care what anyone says, I can always see the scar. I have so many surgeons in meetings will show photos of women with their arms up and tell us how great the scar looks. See, it's invisible, and my eye is immediately drawn to it. So I'm not a fan. The other downside is that it does seem to have an increased risk of contracture and infection. And since it's a small incision kind of far away where you have to tunnel, it can be more challenging to safely place, especially the more current generation silicone implants that are of larger size. Okay, the next one is the periareolar incision. So this is an incision under the areola in the center of the breast, and you go down through the breast tissue to place an implant. So the benefits are that that incision often heals very nicely around the areola. It is still visible when you look at yourself in the mirror. Some of the downsides of that incision is a higher risk of capsular contracture as well as infection. And you're also cutting through the breast tissue, so it's more likely to cause issue with sensitivity as well as breastfeeding. And depending on the size of the areola, it can be challenging to get larger silicone implants through that incision. So the next option is the inframammary incision. This is in the crease of the breast. This is my preferred incision when I'm doing augmentations. With this incision, there's a lower risk of contracture and infection. It's also the preferred incision for complicated revisions, which I do a lot of, so it's another reason I love this incision. And when you look at yourself in the mirror, if it heals well, you cannot see the incision because it's kind of tucked up under the breast. If it doesn't heal in the right place, then it can be visible. And then finally, the tuba, the transumbilical incision. So this is where you make an incision around your belly button, you tunnel up to the breast, and you place an implant that way. You can do it either blindly with tools that just spread and then place the implant that way, or you can use an endoscope. Downsides of this is the belly button is not exactly known to be an infection-free location. You're also tunneling implants, which again is challenging / not possible for silicone implants, especially if they are of a decent size. And if your surgeon is doing this without an endoscope, there is a pretty significant possibility that they are going to place the implant somewhere they don't mean to, meaning that it's supposed to be under the muscle and it ends up over. Although you can do revisions through all of the incisions, usually the inframammary incision is the easiest to do a complicated revision. So that's just a review of all of the common locations for incisions. Let me know if you have any more questions.